And welcome back. I'm Dylan Black. A very important week is upon us. Next week it is Mental Health Week. We'll raise some awareness and how we can just feel better about ourselves right now with the lovely Dr. Catherine Horvath. Thank you very much for being here on the show again. Mental Health Week, obviously a very important week. It's coming up next week. You are the founder and executive director of the Ottawa Centre of Resilience.
Yes,
Resilience.
I am.
So how long has this been around for at this point?
We've been open for a year now.
So you're celebrating the 1-year anniversary?
We are, yeah, in May.
What is your mandate? What do you guys do there?
We're Ottawa's only specialized mental health centre in childhood trauma, attachment, and adoption.
Okay. So you decided to create this, open this up, because obviously you saw that there was a need there.
I did, yeah. There isn't a lot of specialization in that area, and partly because they're challenging and resource-intensive families and kids to work with.
Okay. So where are you located out of exactly?
We're at Bank and Riverside,
Riverside?
right near Billingsbridge.
Okay. So we have this week upon us, Mental Health Week. How many years in existence have we had an actual week to talk about mental health?
This is the 66th year.
66th year?
Yeah.
Okay. But obviously within the past, I guess, decade or so, it's become very apparent that this week is super important.
Yeah, I think that the visibility has become a lot more in the last 10 years. I think we're more comfortable talking about it, and with social media and internet, the message gets out there more.
Yeah. Would you say, though, just quickly, just to go into a little branch here,
yeah,
the internet, social media, has it helped mental health awareness, or like it's?
I think it helps a lot. I mean, it's easier to reach more people, and so the more that people feel like they're not alone and there are other people talking about it, that can help with the stigma and help people come forward. The Bell Let's Talk campaign has done a lot of good things for mental health. Mm-hmm. But social media also has its downsides for mental health, especially for youth. Mm-hmm. It's sort of opened up this whole new world of bullying and difficult peer relationships.
Yeah. So you're obviously seeing that.
Yeah, we do.
Yeah, okay. Tell us about this week. I mean, it's created obviously for awareness.
Yeah, so it was originally created by the Canadian Mental Health Association to draw attention to mental health and just get people talking about it, with the idea being that the more openly we talk about it, the less stigma there would be, and and less shame, and the more comfortable people would feel seeking out help and coming forward when they need it. This year there's a particular focus for the week, which is focused on waiting times. And so, you know, there's differences by city and region, but in general across Ontario, adults as well as children and youth are waiting up to a year to access publicly funded mental health services.
Wow. So then how can we fix that problem? I mean, that seems...
Money.
Yeah, really? Okay.
The answer to everything. Yeah. But I mean, I'm being a bit glib, but really, I mean, there isn't... Mental health doesn't receive funding on par with physical health. Mm-hmm. And so increased funding to mental health to reduce wait times and increase access would be a good start.
Yeah. So you're honestly telling me if a child comes forward and they're having mental health issues, we're looking at wait times of up to a year before somebody can even see them?
It has, like, they can present to the ER if it's very serious and acute, and they will get seen. But if it's not at the point of imminent physical harm to the child, up until recently they were waiting a year to 18 months.
Wow.
However, I should mention that in Ottawa, the Children's Hospital, the CHEO, has just revamped their whole system to introduce a new program to address the wait times. Mm-hmm. And so they're now aiming to see kids within 3 to 4 weeks of presenting.
And that's exceptional. So this is through the Children's Hospital?
That's correct.
Wonderful. Okay, so mental health difficulties, I mean, how common is this? Now, we're not only talking about youth, adolescents. Are we talking about elderly? Are we talking about, you know, adults? Yeah. How big of a problem is it?
So we know that in any given year, 1 in 5 Canadians will experience significant mental health difficulties, and that's across the age range. And then if we look at sort of by the time Canadians reach 40, it's 1 in 2 will have or have had experienced a mental health difficulty. So that's 50%.
That's quite a bit. That number's staggering. So what would be contributing to this? Just, you know, the wear and tear of everyday life, or I mean, what's the number one problem here? Or reason?
I'm not sure if you can narrow it down to one single problem. I mean, I think stressors of
Many
everyday
factors.
life and exposure to traumatic events contribute, and biology and other things. But we know that, like in the adult population, because there's still stigma and people feel this obligation to keep working, and I think it's only 1 out of 3 people would actually report mental health difficulties at work, right? People feel an obligation to keep that under wraps, kind of, as it was. And it actually costs the Canadian economy $50 billion a year in lost productivity.
Jeez. Okay, so then what do we need to do to help change? I mean, obviously you're talking about financial assistance, but if that's not able to be done, what can we do?
Well, I think the prevention is really where it's at. So the sooner we're intervening and recognizing the beginning symptoms, so getting help early, because the sooner you intervene, the less intervention you need and the less chance it goes on to become a chronic problem.
Okay. So then how do people assess this early? I mean, do they go online? Do they find help? Do they seek help?
Go see you could just go see your family doctor is a really good starting point, and hopefully most people can do that. There's no cost associated with that.
And if they're not able to, can they get more information online? What would
Yeah, so the Canadian Mental Health Association has a very good website, and there's a number of resources on there. The internet's a great place for resources, but you have to use consumer awareness, because there's a lot of quizzes. People love quizzes, right? And you can diagnose yourself with a lot of stuff online.
Yeah, definitely
so you have to watch out.
And for more information on the Ottawa Centre for Resilience, ocfr.ca is the place to go to. Thank you for shining some light on Mental Health Week, Dr. Horvath.
Thanks for having me.
Thank you for being here. We've got more coming up on Daytime. Please don't go anywhere.